She specializes in the treatment of pain management and mobility. And her philosophy generally, and I'll let her talk about it more obviously, is that the body is an integrated machine of moving parts, leading to a non-surgical approach. So I'll let her talk more about that obviously. So on the theme of work-life balance, Dr. Snowball, I wanted to know, given that a lot of people spend their day at their computers, right? They're sitting, or if they're not at a computer, they're sitting a lot in general. So, how do you not let that snowball into a problem? That was planned. Right. So how does that not, what are your tips for mobility, getting people moving when they have a job that requires them to sit a lot, for example?
Right. Well, I think going back to the concept that we began with, that the body's a machine. It's an interrelationship of moving parts. In medicine, we tend to be very transactional. That spot hurts, fix the spot, and it should be all better. But the spot is related, if it's on the muscle, to the joint before it, and the joint on the other side of it, and there's interrelationships. So when we're sitting at a computer, our posture obviously is very important, and I think we're all aware of it, but it's very difficult to implement it. Right?
Everyone always stands up with someone mentioning posture.
An interesting fact is that our head weighs 10 to 12 pounds, and when our head goes forward, as it does in our culture constantly, our culture is texting, typing, driving, cooking, reading. We're like this. Physical therapists in-house will fondly often call that the Hulk position. So our job is to straighten up, because the head, which weighs 10 to 12 pounds in an upright position, turns to 40 pounds of weight head forward. And a study discussed that and showed that about a year and a half ago. So we create a suspension bridge mechanism, and all of that force and weight is borne by the muscles of our neck. So that's why we're walking around with neck pain. And we're fondly in our office calling it tech necks. So it's computers, it's texting, and of course texting also brings with it thumb issues. So we're overusing our thumbs, so I'm seeing a lot of inflamed thumb joint issues in my office. So I think posture, keeping our head over our spine, where the head then weighs 10 to 12 pounds again, coming out of 40 pounds to 10 to 12 pounds, and it's simply a chin tuck, and it puts our head over our spine, which is like concrete or cement, or the infrastructure of our body, and can handle that weight. So it's a little tip on ergonomics and protecting your neck from injury.
Tracy Fox, who I'm also really excited about, is a best-selling author and NYU certified life coach. How you've dealt with clients who face a lot of anxiety and stress, because sometimes I think the feeling is that they can't control it. Anxiety or stress, deal with that.
Well, this is the problem of our age. I mean, I think we're having an epidemic of anxiety. There was some recent article about 8 out of 10 kids in middle school have anxiety. That's crazy. We have to get a hold of this. And again, it goes back to what I said before. You are either managing your life or your life is managing you. And when you are in a state of anxiety, you are either thinking about the past, like some regret, something you did wrong, or you're worried about the future. Something uncertain is going to happen. But again, I believe unless it's a very serious neurological condition, we really do have the ability to control our own anxiety. But I think, and this happens with a lot of my clients, they don't realize how much personal power they have. We all have power to manage our lives and to decide, I will decide if I have stress or not. I will decide what this means. And I talk about Plan A and Plan B. Plan A is, I'm going to do something about this. But if it's a situation that you can't do anything about, you go to Plan B, which is, I will decide how I feel about what is happening to me. And again, we're the only creatures on planet Earth that actually have the brain power to decide who we want to be and how we want to operate. Animals don't get that, privilege. And so really, don't lose your personal power. Don't give your power away.
So, neck and shoulder pain, migraine headaches, which is an epidemic.
Yes.
How quickly should we act and what can be done?
There's a lot that can be done for migraine headaches, a lot. And no one needs to suffer with migraine headaches anymore. There are a lot of medications out in the world that have taken my patients who have migraine headaches day and night, 7 days a week, to no headaches. We all know Botox, that's kind of the product out there as well, and that's an injectable that we use a lot for migraine headaches. That's dealing with more of the vascular aspect when we use medications. And there's also a cervigenic component. That means a neck pain concept. So half of it is vascular and half of it is cervigenic. Which
And
is muscular.
anti-aging. It's like a twofer. Really,
I don't think you're injecting it in this thing.
Yeah. So then you treat neck pain as well. And if you do the two together, if you treat the vascular component of migraine headaches and treat neck issues as well, and you ask patients with migraine headaches, they frequently say, oh yeah, I do have some neck pain, and we treat that as well, then it leads to really good outcomes. So
Great.
it's a great,
very helpful.
Yeah.
Thank you.